Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today's Friday, April 17th at 5 p.m. Okay, since we are all social distancing to avoid getting sick with COVID-19, can we be doing things right now to boost our immunity so when we are released, if you want to use that word, we might be better protected? We know diet and exercise and other lifestyle choices can make or break our immune system. And of course, our toxic load, our body burden, makes a huge difference on how your immune system and overall health is functioning. But what about supplements? Okay? Nutraceuticals, whatever you want to call them, right? I've talked before about the dangers of inflammation in the body, but understand it is a normal immune response to help fight off infection and help the body repair. But sometimes inflammation can do more harm than good. In the case of COVID-19, the leading cause of death is acute respiratory distress syndrome, or ARDS. This is an inflammatory response by your immune cells in the respiratory tract to respond to the virus, but for many, the response is the problem. Some nutraceuticals can actually help reduce or shut off this inflammatory response. Now, understand, I'm not telling you that what I'm going to talk about next is a cure for COVID-19. I am not saying that. I am not telling you that anything you take, as far as what I talk about, is going to prevent you from getting sick. But anytime you look at scientific information and you can use that judgment in your mind and say, yeah, that might help my overall immune health, you are doing your body a service as opposed to a disservice. You're doing your body a good thing by trying to help your immune system be stronger. So the first one, and we've talked about these before, is vitamin C. Okay, powerful antioxidant that can strengthen capillaries for gas that are responsible for gas exchange. Okay, and gas exchange in the lungs is critical for any type of pulmonary inflammatory response. Now, clinical trials are underway to see how effective vitamin C is in treating COVID-19. Researchers speculate it may speed recovery by interfering with viral replication and reduce those ARDS symptoms. Number 2 is zinc, another antioxidant that plays an important role in the function of your T cells. Those are part of your white blood cell system. It may help inhibit the release of pro-inflammatory cytokines, especially in people with autoimmune disorders or those at risk for cytokine storm. And number 3 is vitamin D3. A key player when it comes to immunity. Human airway cells actually have vitamin D receptors, so taking vitamin D may actually cause a decrease in those pro-inflammatory cytokines, specifically in the lung. Now, vitamin D deficiency results in increased susceptibility to acute viral infections, especially to viruses like coronavirus. Vitamin D3 triggers the release of peptides that destabilize the viral envelope. The viral envelope, if you want to think about it, is kind of like the cell membrane for a virus. And lastly, for today, because we'll continue this on Monday, is vitamin B3 or niacin. It's a water-soluble antioxidant that has been shown to reduce lung inflammation by decreasing the immune response of neutrophils in the lung. Again, it's not a cure for COVID-19, but may help improve your lung function to speed up healing. So again, understand, anytime you want to add any of these things to your health routine, most of those are pretty generic, if you will. Speak to your healthcare provider before starting anything new in your healthcare routine, but these are pretty basic vitamins that everyone can or should be taking anyway. So if you're not, this might be the time to start, but again, discuss it with your doctor. So on that note, hope you guys are planning a very lovely weekend with your family. Stay home, stay safe, but get outside, get some natural vitamin D going on. Enjoy yourself as best you can. We're going to get through this. And I will see you again on Monday for another Live in 5.